they're falling. So this is present from 4 to 8 months and onward. So, and this is important for obvious reasons. As they're getting into the 4 to 8 months, they're going to start standing and crawling and walking, and they need to know how to catch themselves when they are falling. And we retain this one even into adulthood. We may not necessarily remember how we fell, but our hands are skinned and our faces hopefully aren't. The next reflex is the tonic neck reflex, not to be confused with the asymmetric tonic neck reflex. And this is, again, similar in an opposite way. For the asymmetric tonic neck, we had the head being bent toward the arm and leg that were straight. For tonic neck, we're going to bend the head towards the arm and leg that are bent. Now, this is what we talked about with asymmetric. We will see tonic neck occurring as the asymmetric decreases, because now we need to be able to turn our head towards the arm that is bent to assist with crawling and eating. So it's important for all the other reasons that we mentioned. This one you will often see retained in children and adults. A lot of times when we're sleeping, if people sleep with one arm up on the pillow, their head will usually be turned a little bit that way. So that's one we can see retained into adulthood as well. The last reflex is the neck righting reflex. What happens in this reflex is that if you turn the baby's head to one side, their whole body will follow. This also begins to occur after the fencer reflex has diminished. So around 4 to 6 months, and it lasts until about 8 to 10 months. And this one is important in helping the baby learn to roll over and in learning to crawl so that they can move. After 8 to 10 months, then the action becomes voluntary. At this point, we can move our head and our body wherever we want to by choice. So as we look at this whole sequence of what we have, of the reflexes and what has been happening here, we see, first of all, that the tight space of the uterus puts pressure on the baby's head and, puts pressure on the whole baby, which stimulates then as they move and push off with their feet. Then we have more pressure with the head on the cervix. This begins the very start of labor. As labor starts and contractions begin, now we have the baby going into full flexion, very curled, and as the baby drops lower into the birth canal, now there's going to be muscles and restrictions that will cause so the baby will start to turn their head. As they turn their head, that shoulder will also come up with the reflex and allow them to drop down further. Then we get the whole cranial molding system going on. First the parietal bones overlap, then the frontal and occipital bones overlap, and the baby can drop down even lower and turn their head to the full 90 degrees with their nose towards the mother's back. Then as we continue to get these contractions, now we're getting more pressure on the baby's back. And as we stimulate the Perez reflex, now that will cause the baby to bend their head up and under the mother's pubic bone when they are born, and then also to cause the twisting of the hips so that we can get the hips through the birth canal. And then and then the baby is able to continue to turn and slide. We get down after Perez, then the baby turns their head back to the side so that the shoulders can come through, and then the hips turn and slide out. So now I would like to show you again the graphic illustration of how these reflexes relate and work together and what happens in some of the scenarios when they don't work. Great,
Mom,
thank you.
I'm getting tired of being squished in here. I'm hugging myself as tight as I can, but it's getting harder and harder to move my hands and feet.
Around the 7th month of pregnancy, the volume of amniotic fluid in the womb starts to drop. This change in fluid dynamics gives the baby more room to grow while decreasing his buoyancy. Gravity can now take over and pull the heaviest part of his body, his head, down against the lower cervical portion of the uterus. The uterus, the baby's spine, and the mother's spine will now all become parallel with each other. This is essential for an uncomplicated birth to occur. Ideally, after much tossing, turning, rolling, and playing, the baby will position himself with his back on the mother's left side. Most babies will assume this position because the mother's softer organs, the stomach, spleen, and pancreas, will move up against the respiratory diaphragm and make room for him to stretch out. There isn't as much room for a growing baby's spine to reside on the right side of the mother's abdomen because of the harder, less flexible liver that rests on that side. If the mother's sacrum is rotated, causing a subluxation at the site of the sacroiliac joint and a torsion of the pelvic bowl, an imbalance in the uterine ligaments will constrict the lower portion of the uterus, forcing the baby out of this optimum position. Gravity can no longer influence the baby as the tight, constricted fibers of the uterus force him to turn into an oblique, transverse, or complete breech position. Correcting the subluxation and restoring balance to the muscles and ligaments within the mother's pelvis, often called the Webster technique, will quickly and effectively restore the pelvis to normal, and the baby will drop back down into the optimum position within the uterus. During the third trimester, very gentle contractions that hug the baby also begin to push him downward against the cervix. These Braxton Hicks contractions should be mild and barely perceived by the mother. Ideally, the baby's arms and legs are now flexed against his chest. At this point, with the long axis of the baby's spine perfectly perpendicular to the long axis of his head, Braxton Hicks contractions will force the baby's spine downward, forcing it to apply symmetrical pressure to the condyles of the occiput. If the baby is positioned correctly, the contractions will slowly and gently force his sphenobasilar joint and head into a flexed position. As the baby's chin is forced against his chest, the vertebra will stack up and protect his spinal cord and nerve roots from the forces of labor. With his head tucked tightly against his chest, the baby will now have the crown of his head resting against the top of the mother's cervix, with the widest diameter of his head parallel with the widest diameter of the mother's pelvic inlet. In order for an unborn baby to effectively fit through the mother's cervix and pelvis, his cranial plates must slowly overlap each other, and the volume of cranial fluid must be reduced. This will be achieved through a unique process called